Hi, my name is Alec Delancey, and today I want to talk about ADHD. Now, ADHD, it is attention deficit hyperactivity disorder. A number of persons, they have been asking the question, is ADHD an intelligent issue? Is it that it's an intelligence disorder? Well, the answer to that is no, ADHD is not an intelligence disorder. A matter of fact, a person, a child, an adult who might have ADHD may have just as much intelligence or probably more intelligent than one person over another who might be in a classroom or maybe in a job. So you find that ADHD does not mean that the person has a learning disability in terms of their intelligence being affected. What ADHD is, in many instances, it's a disorder of hyperactivity or impulsivity or inattentiveness. In the case of the inattentive child who might be in a classroom, that person may not be able to focus for very long periods of time on a specific task. And in the case of hyperactivity, in the classroom, that child may not be able to settle down. They may take things, they may speak out of terms often, and they may have some issues with other students in the classroom. They may have issues with the teacher. They may be very confrontational or very aggressive at times. Not saying all ADHD children are that way, but those might be some presentations that you may see with a person who has a diagnosis of ADHD. Now, in many instances, a person may say, well, okay, if it is not an intelligence disorder, then how is it that that person is disorganized or they're not able to plan? Well, what this disorder is, this ADHD, it is an executive function disorder. In other words, the prefrontal lobe of the brain, it is where the person may have some challenges where brain development or the ability for the brain to work in a very structured way may be a deficit. So the person has challenges when it comes to planning, the person has challenges when it comes to organizing tasks, and it is one of the reasons why you may see a ADHD child not being able to stay on task or not be able to plan or may appear to be very disorganized. They lose things often. They fail to comply with rules or regulations or consequences in the classroom when administered may appear to not work. Not that the child has a problem with listening, but they have a problem with focusing on a specific task or focusing on a specific rule that does not bring a level of enjoyment. So we're not saying that ADHD means that the child cannot focus. An ADHD child can focus. A matter of fact, some ADHD children are very hyper focused. They're able to do a specific task and remain at that task for a very long time, especially when that task, or more so, when that task brings some level of enjoyment or some fulfillment. So if it is that the ADHD child loves mathematics, they may spend hours and hours and hours on end without moving or eating or wanting to go to sleep because they're focused on mathematics. If it is that they're focused on video games, a specific video game, they may actually be focused on playing and trying to get to another level or to get more points because they are hyper focused on that specific game. So ADHD children do focus, they can focus, but what they focus on, it must bring them some level of enjoyment, or it must grab their attention. Another thing about ADHD is that in order for ADHD child to perform on a specific task that you may give them, you have to change what we call the point of performance. So if it is that the typical functioning student in the classroom, they are able to focus on a specific task for 20 minutes, the inattentive child will not be able to focus on the same task for that same 20 minutes. They may take longer. So you have to, in order for them to show what they know, because they do know, but for them to show what they do know on completing the task, you may have to lengthen the time. Now, in a situation where the child who has the diagnosis of ADHD loves very much what they're doing, let's use the example of mathematics again. You may have to reduce the time because they will complete that 20-minute assignment in about 10 minutes, and then what else will they do for the next 10 minutes? Well, in order to keep themselves entertained, as it were, they will now engage in some kind of behavior that many times it is one that will be considered disruptive, or one that may trigger some ill feelings between another student, or they may engage in some kind of fight, or name calling, or probably tapping on the desk, or getting up, walking around, or trying to get the attention of another student who is trying to focus on the specific task that you have given to the class. So you have to change the point of performance for them to demonstrate what they know. One of the things that we sometimes tell ourselves is that the ADHD child, you simply give them a schedule, or you give them a check sheet or a checklist, and that will help them. Well, it won't help them, because remember, the ability to focus, unless of course they enjoy doing check sheets and just checking things off, that brings some kind of enjoyment. If that is not the case, then they will simply forget. They will not find it of interest to take anything off. So what you have to do is basically create an environment where the child is able to be engaged by having things in their environment to remind them to be engaged on a specific task. So you have to make that self-regulation not internal but external, because they cannot regulate themselves. Maybe not cannot regulate themselves, that's an erroneous statement, but they may not regulate themselves on a task that you want them to be focused on. So you get things like clocks and watches or timers that will beep, things that will make some noise, flashing lights, so as to remind them to complete a specific task, or to remain on task, or to get back on task, or to calm down, or to relax, or to take some deep breaths, or to re-engage a specific task that they are involved in. Another thing that we have to remember too is that in mild and many cases severe, or probably in all cases of severe ADHD, medication needs to work in harmony with therapy. I know there are some persons who may have some concerns about the medication, and yes, there are side effects of the medications, but it is necessary that the brain receives some kind of chemical to help regulate behavior, especially when behaviors are mild, or maybe not mild but moderate to severe. In cases of mild, maybe medication might work for hyperactive or impulsive children. However, in moderate to severe, medication for ADHD is recommended. So ADHD, again, attention deficit hyperactivity disorder. It is not an intelligence disorder. The child does not have an IQ problem. The child knows probably just as much, but they are not able to show what they know because they are constantly interrupting themselves. They are not able to focus as long as they probably should on a specific task, and that is what causes them to not perform well on the specific task. And of course, if they are not able to focus long enough on a specific task, then they may not be able to memorize the information or to understand the concepts of the information. So when the exam comes around, they may not be able to answer the question, and it may seem that it's a learning disability, but it may not. I'm not saying that in some cases ADHD children do not also have learning disabilities, but ADHD in itself, it is a neurodevelopmental disorder, and it is not connected with any learning disorder in terms of it itself being a learning disorder. So I hope that this video was informative, and if you like it, you can subscribe to the channel and you can give me a thumbs up. So take care.